శరణు మాయమ్మ గంగారావమ్మ శరణు జేకోని మమ్ము కరుణా చూడమ్మ.
For the poor of the world, losing even one animal to illness or injury can be a devastating blow to the household income. But veterinary services to maintain animal health and productivity are often out of reach. In Andhra Pradesh, India, a fresh look at this issue is making vaccination and treatment possible. It is us, the poor farmers, who keep most of the livestock in this part of India.
हम अपनी तरफ से पूरी कोशिश करते हैं, मगर बीमारियों के कारण
we do our best, but we can lose a third of our sheep to disease.
మేము దాని గురించి డిస్ట్రిక్ట్ లెవెల్ యూనియన్ లో
What we farmers wanted is that exactly as the government supports self-employed workers for the large animals, we wanted a village health worker for our small animals, sheep and goats.
So certainly some kind of change was needed. Now what that change was, that needed to be discovered from within, from the farmers, civil society organizations, the academics, those who were associated with veterinary education, all of the people.
The Veterinary Council of India specified that the minor veterinary services to be provided by para workers should be clearly defined. But such a definition did not exist. The consultative processes which went through at 3 different levels brought out these problems, beginning from village.
In the beginning, there was this problem of the shepherds finding it very uncomfortable to talk to an official directly. So every time we hold a meeting, we encourage people to start talking and give their opinions and gain the courage to even talk to an official, which was not there earlier.
నాకు అది చాలా బాగా గుర్తుంది. నేను ఆ మీటింగ్ కూడా అటెండ్
I remember going to the meeting and voicing my opinion on the veterinary services required. We asked for vaccinations. Seasonal vaccinations are what is important.
To start with, there was a lot of resistance. See, leaving some of the service activities to people trained for short time and outside government structure.
This tension between the professional veterinarians and different kinds of service providers, one thing to do was get the two groups together to talk to each other. When you give them a problem and say, okay, now you tell us who should do, and then they started appreciating each other's role in this.
The facilitation was done by the staff of the animal husbandry department, mainly the veterinarians. And they were at the front line of negotiations. Those who could have created the resistance, they themselves were front runners in the facilitation process. This process of involvement and facilitation helped improve the ownership of the changes which we are talking about, acceptability, and later the implementability of the reforms proposed.
Until now, there is no role clarity. With this government order that was signed in September 2007, now all these people will be registered and their practices will be regulated. Probably their skills will be upgraded.
I'm very clear what it is I'm supposed to do. Only I do first aid, minor treatments, and mainly artificial insemination like today. I never attempt any risky higher level of treatment. If such cases occur, I refer to the vet.
Definitely, results are better. We have got para workers for sheep, and they take up the sheep activities. The farmer also gets the quality service from the competent person.
I have 50 sheep. Already I am getting my animals vaccinated and protected from serious diseases.
If I look back at the process now, we did something which was a bit unusual, perspective building programs, initially to take them away from their context of livestock and then bring the context of livestock back. And I think that was a catalyst towards bringing consensus and bringing people together.
Indeed, the animal husbandry department staff, there has been a lot of change in them. And the change because of the fact that they were at the center of this consultative process.
Before, as a vet, I had fears that a village person could not be trusted with medicines. But now I have respect for the para workers, their commitment and professionalism. Working together, we can achieve so much.
I know who's for buffalo and who's for sheep, and whenever I call them, they come. They see to the health of the animal to make sure they are not sick.
ఆ మీటింగ్ వల్ల ఇచ్చినటువంటి సలహాలు కొన్ని
I think the process has been very good, having a consultation with people like us. Our problems, our ideas have been heard by the government and action taken.
సువని నేనొక్క పాట పాడంగా పూటు వేయంగా